in the next decade. Despite the tremendous progress that has been made over ensuing decades, their hopes could not have been more unrealized, as the parade of distressed individuals seeking assistance daily all over the world for relief from the suffering caused by their sexual problems continues to this day. Of course, there is no one cure. But Sensate Focus in Sex Therapy, the illustrated manual, provides a guide to familiarize, reintroduce novice sex therapists and experienced master clinicians, as well as the public at large, to a technique that has universal application in almost every case where sexual symptoms exist. This book has a number of strengths, but I want to highlight a few for the reader. Most important to the professionals reading this book, the authors advocate for and practice a type of communication that is key to good diagnosis and treatment. First, quoting Marcel Proust, "Be precise, my dear, be precise." The authors elaborate. As therapists, we must be Proustian in our measured attention to the details of sensation descriptions, so that our clients will want to divulge everything down to minute details. The key to a good sex status, focused sex history, is obtaining the details, and that can be part of almost every consultation. For the novice therapist in particular, explicit and elaborate explanations of the why and how to give instructions for Sensate Focus is quite useful. The authors explore the theory behind reducing performance anxiety. This is a common cause of sexual disorders, and one that is almost always a factor in the maintenance of sexual disorders, regardless of whether a pharmaceutical and/or sexual counseling has been initiated. Both the why and the how to initiate Sensate Focus instructions are provided, with sensitive consideration for diverse patient populations and varying, overlapping disorders. Again, the emphasis on providing precise and vivid descriptions and seeking the same back from clients is something we all must be reminded to do continuously. For novice and experienced clinicians alike, Weiner and Avery-Clark explore the management of common problems and resistance to both the outcome and process of Sensate Focus. That in-depth discussion includes, but is not limited to, non-compliance, boredom, lack of spontaneity, ticklishness, feeling nothing, sexual frustration, confusion about and difficulties with either or Sensate Focus concepts and instructions. In almost all cases, the process involves the clients learning to recognize and acknowledge their anxiety, communicate it, but then move beyond it by refocusing their attention productively. All are also reminded of the importance of patience when seeking change, and of the necessity to appreciate systematic approximation and embracing how small, iterative steps can lead to longer-lasting confidence and success. Explanation of how to manage distractions through cognitive behavioral mindfulness techniques should especially appeal to those practicing this currently popular approach with its many adherents. Of course, the illustrations themselves, like those in Helen Kaplan's The Illustrated Manual of Sex Therapy, help inspire this current book and offer so much to both the public and professionals alike. However, unlike Helen's own pioneering work, the interpretive, non-traditional illustrations illuminate a broader application of Sensate Focus to a larger group of sexual concerns and a more diverse audience. That varied range is recognizable among the participants, who are illustrated within themes.